दिन में हाथ और पैर और माइंड से करते हैं, रात को हाथ पैर तो रुक जाते हैं पर माइंड तो फिर भी चलता रहता है. सो सुबह व्हेन दे वेक अप दे वर कॉन्स्टिपेटेड, क्योंकि फियर तो गया नहीं. क्यों? क्योंकि फ्राइट एंड फ्लाइट रिस्पॉन्स में जो हमारा ग्रोथ हार्मोन है वो स्टक हो जाता है, और जो हमारा नॉर्मल फंक्शनिंग सेल है वो दे स्टार्ट डिजेनरेटिंग. ईच एंड एवरी सेकेंड 8,10,000 सेल्स प्रोड्यूस होते हैं बॉडी में, जनरेट होते हैं, और 8,10,000 डीजनरेट होते हैं. तो क्यों हो रहा है? अगर ये परफेक्ट कैलकुलेशन है तो किसी को इलनेस ही नहीं आनी चाहिए. बट होता क्या है, हम जो कांस्टेंट स्ट्रेस में रहते हैं, इमोशनल ट्रॉमा रहते हैं, तो उसमें सेल का जो बोलते हैं ना क्वालिटी, वो क्वालिटी नहीं आती. जैसा मरा वैसा पैदा हुआ. तो हम क्या बोलते हैं कि अगर हम प्रोसेस को ठीक नहीं करेंगे तो प्रोडक्ट को हम कभी ठीक नहीं कर पाएंगे. तो प्रोसेस को ठीक करने का एक ही रास्ता है, सेल्फ अवेयरनेस, कि मेरी लाइफ में चल क्या रहा है. तो सेल्फ अवेयरनेस से हम, आई एम फ्रॉम गुजरात, तो मैं अगर बिजनेस की भाषा में बोलूं तो क्या होगा, अगर पूरी प्रोसेस को ठीक नहीं करेंगे तो प्रोडक्शन कैसा आएगा? खराब ही आएगा. तो अगर अपने को प्रोडक्शन ठीक करना है, यानी ये जो बॉडी है ये बॉडी प्रोसेस है, ये बॉडी कोई मशीन नहीं है. तो अगर इस प्रोसेस को हम ठीक करेंगे माय डियर फ्रेंड्स, तो जो प्रोडक्ट है वो अपने से ठीक होना चालू हो जाएगा. जैसे सुबह में न्यूटन सर और लक्ष्मी मैडम ने बहुत ब्यूटीफुली एक्सप्लेन किया कि ट्रॉमा शुरू कहाँ से होता है, चाइल्डहुड, जनरेशन, इन यूट्रो, पास्ट लाइफ. तो आई हैव सीन more than 12,000 of cases in my up till this history. I have all papers, all records. Anyone wants to do case study and produce a published newsletter, I'm ready to share. So, and there are multiple patients who are cured with meditation, medicines with meditation, ankylosing spondylitis, ulcerative colitis, rheumatoid arthritis. So friends, एक बार बोल दिया ऑटो इम्यून डिजीज ठीक नहीं हो सकता. नो, एवरी डिजीज वी कैन क्योर. गिल्ट, फियर, एंगर, these are the main killers of mankind and cell. So my recommendation, do meditation and be self-aware of life, and we can heal all the disease, we can heal all the globe. Thank you.
Wonderful. Thank you, Dr. Kushali. So what you are saying is stress is the biggest killer. And of course, all of the current lifestyle, the work pressures, the societal pressures, all of that is obviously leading to pressure. So what we need to do is to deal with that stress, and what you're saying is meditation is the only answer where we can deal stress effectively. Thank you. Dr. Lakshmi. Experience. Dr. Newton said a body is to be lived fully. It's not a problem. Body is not a problem. So how do you say meditation can help, with some example of your experience? Meditation can help live our life fully, move from the disease state to a living fully state.
So, my dear friends, we all know, we have heard so much about meditation, the benefits of meditation. And we also have realized meditation is the ultimate, meditation is the cure, meditation is the final medicine. But what is meditation? In meditation, before you realize who you are, you need to realize what you are not. Because we are not our fears, we are not our thoughts, we are not our beliefs, we are that divine essence. Before you connect to that essence, you have to peel all these layers, whatever you are not. And friends, recently, this beautiful science called epigenetics. And what epigenetics says is, whatever you experience, your environment, the situations, the first 5 years of your life is very important, very precious. And whatever you experience at that time, because every child is like a sponge, and you absorb everything. You start believing in it. So I just want to share this case study about a lady who came to us. She was around 40 years old, and she was suffering with migraine. Very frequent migraine attacks. Very painful. You all know how painful it is. And she went to almost all the doctors. All the investigations are done. Nothing is wrong. Everything is fine with her. And the doctor said, I think you are suffering some psychological problem. There's nothing wrong with you. But she was so upset with the doctors because she knows how much she's suffering because of this migraine. And they're just saying it's all psychological. So somehow she came to us. And during one of the workshops, she went back to the root cause. And the root cause was in her mother's womb stage. Not even childhood, when she was in the mother's womb. So when she connected back to that moment, when she was inside the mother's womb, she could feel all the thoughts of the mother. How mother was feeling at that time. Actually, mother was going through a lot of stress at that time. She just got married, very young, maybe 17-year-old, and she was not ready for the pregnancy, and she got pregnant. Her husband is not at home. He's very busy with his own business trips, and she's not getting along with the in-laws. So a lot of stress. And this mother, she wanted to abort that baby because she felt, oh, the situation is not okay. Even financially, we are not strong. How can I bring up this child? How can I give birth to this child? So with all those thoughts, she wanted to abort this child. And she tried to abort the child 2 times. But she didn't succeed, and finally she gave birth to the child. But when the mother was having these thoughts, not wanting to have this child, the child could feel all that. And inside the mother's womb itself, the child felt a lot of rejection, unwanted feeling. Oh, I want to come into this world, but my mother doesn't want me to come into this world. I want to come into this world, but if I come into this world, my mother will be very upset. She's not happy with me coming into this world. So with all these conflicts, with all this stress, finally she's born, but she's born with a cord around her neck. My dear friends, do you know, for this child to be born with a cord around her neck, it was she wanted to commit suicide inside the mother's womb itself. And when she came out of the mother's womb, after her birth, after a few months, everything was fine, and mother also started accepting the child. But the first moments, the moments when she was inside the mother's womb, all these thought forms, whatever she received from the mother, the rejection, the abandonment, the unwanted feeling, it stayed with her. And whenever the mother used to hug her, she used to push her away. She was repelling the mother. She was so angry with the mother. And this continued for so many years. This love-hatred relationship with the mother and daughter, between mother and daughter, my dear friends. It continued like this. And the constant migraine, it's nothing but the conflict she had when she was inside the mother's womb, whether to come or not, whether to come or not, come out or not, come out or not. And later also in her life, in everything, whatever she wanted to do, whether I should do this or not, do this or not. So it continued like this. So my dear friends, when she went back to the root cause, and in that higher states of awareness, she could understand the root cause for her migraine. And she also understood the state of the mother. She was so young at the time. And she could understand the mother from her perspective, and she could forgive the mother completely for all that she has felt, she has thought of in that state. And after this, I think she just took 1 or 2 sessions, and within 3 months, all the migraine, it stopped. And apart from that, her relationship with her mother improved because she could understand her mother. And she started receiving that love from the mother. And it's amazing. Don't you think it's amazing, my dear friends? Coming out of her migraine and at the same time healing her relationship with the mother. And she could receive that love from the mother. So the root cause is so important from wherever it is. So meditation, it's all about awareness, becoming aware of ourselves. What is it that we are holding within ourselves? All these conditionings, all these blocks. So that we completely come out of that, so that we can be our true self.
Wonderful. So what you are saying, we may have our genes, but how it is expressed depends on what our emotional state is.
And our environment.
Our environment.
Yes.
So wonderful. And second thing I take from here is the awareness that comes through meditation. And personally for me, I used to think that my migraine was part of my life. My sister used to say, you have to handle your stress. But I didn't know how. I was not even aware that I was having stress. So thank you for sharing that, Dr. Lakshmi. Dr. GK, I know you have done such phenomenal work. And probably it will be very hard for you to pick one case or one incident, but I would like you to take one example of how meditation helped heal and share your insights.
Thank you very much, Rakesh, and pranams to Dr. Lakshmi Newton and then holistic doctor from North. So if we go through the search engines like PubMed or Google or whatever, there are thousands and thousands of case studies we can see very clearly. And as a budding holistic spiritual scientist, when I'm operating my 25-bedded rural hospital, during that period, the top floor was completely kept for this spiritual kind of training and treatment, where I used to keep the chronic illness cases and even the serious cases on conservative management. And every day, around a period of 16 hours, the spiritual masters used to guide them to go for hours together meditation and contemplating on their life, understanding their life events and whatnot from before birth to current life. So many cases we are going through. So during that period, one case with the ankylosing spondylitis, young child, and all the investigations were done. The genetical factors like HLA, B27, all the ANA bodies tests were positive. And the doctors clearly said, slowly, by the time he come to me, his neck was completely in a fusion state and he is unable to move his head and with a lot of unbearable pain over the spine. And according to the medical system, over a period of time, the whole spine will become rigid and which is called the bamboo spine state it will reach. And after that, the little movements of the chest wall also will cease, and because of the lung compression and collapse, they may die. So with that terrible state, and he is very poor as well, when he came to me with an MBBS degree with a rural nursing home, I know, being a medical doctor, the ankylosing spondylitis, how difficult it was to cure, and there is no cure for it. And then I said, I openly admitted, whatever the best can happen, it will happen, you keep trying. So he was admitted in the hospital, and he is not in a position to pay money to stay in the hospital. But as a part of the research, I admitted him, and we started keeping him onto regular spiritual tablets, the energy workouts like pyramid meditation beneath the pyramid, and group meditation with the masters, and full moon meditation, and individual meditation daily for a period of 6 to 8 hours in a day, and on a plant-based diet. Within few days, he got some relief in the pain, but there is no much improvement. And over a period of time, I came to know about his lifestyle, and he is already into a kind of a spiritual organization from North India, and he feels that Guru in a great way. He is so stuck with that particular spiritual master wisdom, and he is revolving in and around that wisdom. See, life is like a butterfly, you know. We need to keep moving from one flower to other flower to grasp the nectar. So he is supposed to extend his journey from one master to the other. So the first block we identified, sticking onto a particular wisdom, where the neck part is supposed to look around 180 degrees. But he is completely focused on one angle. So whenever he accepted all masters' wisdom and started looking around different types of wisdoms that are available, and started understanding the spiritual concepts from different masters, immediately he started getting some miraculous future experiences and started getting a kind of release and relief in his neck part. It took around 1.5 month time. And after that, the similar lessons related to the spondylitis area, and especially the whole spine, we call it as trophic signals of the soul, different primary soul understandings, that I gave to him. And by the end of 2.5 months, he got a very great relief. Whatever that fusion part is that is there, the fixed neck patterns, that was completely relaxed. And eventually he got discharged. And I followed him for a period of 1.5 years. And without any pain and restriction of the movement, he continued his life. And he got married, and children, and life. And today, he is the online in charge for the intensive care unit of Spiritual Tablet Research Foundation, where regularly he will do counseling for serious illness cases in breakout rooms. In between, there is a long story, but till today, he is live and without pain, and he is moving better. So this case led to a thought, and one fine night, I tried to calculate the amount of money that is involved in the cases that I did. Out of 1100 cases, low back pain 100, diabetics around 40, and hypertensive around 185. All these successful cases, when I counted the amount of money involved, if you take the laminectomy surgery cost at those days in 2003, around 40 to 60,000, around 60 cases which are bound to go for low back pain surgery, it comes around 1.5 crore. Similarly, that money came to around 13 crores of rupees of money we saved. And I understood where all this money is going. Apart from money, how much amount of suffering they have to go through. So that is the day I decided a simple breath observation meditation and the wisdom capsules, if they are giving a great relief, then why can't I have to choose this path? And that is the one where I came out of that conventional training and became a full-time counselor and workshop trainer. So,
Wow.
Thank you.
It's an amazing case. And the point that you brought, with simple meditation, we have within ourselves to heal. And Dr. Newton also talked about it in the morning. He said, every illness is teaching us something. And this case, you really brought that out, saying we learn from our illnesses, and that's how we heal ourselves. So thank you so much, Dr. GK. just want to cover, in the interest of time, so the conference focus is to how we can take this wisdom and make it a policy and make it much more widespread. So I know, Dr. GK, you spoke about how government can take. So in the interest of time, I'll ask Dr. Lakshmi and Dr. Kushali. So what can we do? I know we know this from our practice and from our science that this is possible. So how can governments and companies and the society can take this in a much bigger way? So if you can say it one sentence.
Yes,
one or two sentences.
one sentence. Yes. So actually, this education should be given to children at a very young age. Because we teach them about chemistry, physics, mathematics, but what about life? Our children, they don't know how to deal with their emotions, how to master their emotions. So these things should be taught, what they should eat, and how to deal with their emotions. Because sometimes children are so upset, so angry, so sad, but they don't know what to do with that. And we say, don't be angry, don't be sad. So they just suppress all that. And you all know, again, all diseases are psychosomatic. So we should teach them at a very young age. Like for example, when we visited Europe, in our friend's place, there were 3 kids. And they all love animals, but they were eating non-vegetarian food. And then they didn't even know that the food is coming from there. And constantly they are programmed, conditioned that you have to eat non-vegetarian food because you have to be strong. But who said only by eating non-vegetarian food you will be strong? Just take the example of elephant. How strong it is, and it's a vegetarian. Right? So this should be taught to children at a very young age, as early as possible. That's the first step. And the second is caring for the mother nature. Like for example, whatever we have experienced past 3 years, just because we were ignorant of the interconnectedness of all living beings. As human beings, we are thinking we are the superior ones and only we have the right. And a great master said, there is enough for everybody's need, but not for greed. Okay? So because of this greed, what are we doing? We are like interfering with the other beings. And we all have to realize at this point of time that just a single butterfly disappearing on this planet Earth, the whole creation disappears. Because the butterflies, they do so much work, they pollinate. And that's why the trees are grown and we get food. If we don't understand that, if we interfere with the nature, if we destroy all the other beings on this planet Earth, and if only human is remaining on this planet Earth, then we don't have fresh air to breathe, we don't have food to eat, we just can't survive even for a single minute without other beings.
Wonderful. So the message, I think, for the universities and colleges and schools, I think the message is clear. Introduce meditation right from the beginning, right? So that's a message I can take. And of course, for all the corporates, live sustainably, right? So that, and of course, meditation can help live sustainably. So Dr. Kushali, finally, so your perspective, how the society, the medical practitioners themselves, right? So how can they help take this meditation to everybody?
Yes, Dr. Lakshmi ma'am says absolutely right. But in medical practice, all practitioners in all colleges, BHMS, Ayurveda, and MBBS colleges, there has to be curriculum of at least 1 or 2 weeks. We are studying in colleges, physical body, anatomy, physiology, everything. We should also study spiritual science. We should also study the inner governing force that can help the whole society. So, also since 3 days, there is one conference is going on in Epicon. All India physicians meet. So, in this type of medical meet, there has to be some 1 or 2 hour lecture of spiritual science, meditation, how it helps the society. Because the doctor is the one person from where whole society heals. So, I request to government, all policy makers and all, ki we should enter this meditation program, self-awareness and basic things in curriculum, so we can help the society. And all in regional colleges, as I say in Gujarat, in all states. Also, when there are happening some meet at the national level, regional level or global level, there has to be some 1 or 2 hour session of this.
Thank you, Dr. Kushali. I think for all medical practitioners, this is a wonderful opportunity. And I think there is a lot of research, placebo effect, where doctor with the intention of healing, when they give the medicine, patients get healed, and same thing reverse happens. So it's important how medical practitioners to practice meditations. Thank you so much, Dr. Lakshmi, Dr. GK. We have a very short time, but I think this was very, very powerful. Thank you.